Hello everyone. Today we will talk on a very common topic, that is metastasis. It is a frequently asked question in the Viva as well as short and long questions in your theory exam. Now, what is metastasis? Metastasis is spread of a tumor from the site of origin to a distant site. Remember, I have highlighted in bold, to a distant site, and discontinuous from the primary site. These two words are important: distant site and discontinuous. Let's take an example. If a patient is suffering from carcinoma breast and the tumor spreads to the brain, then it is called as metastasis. Okay? Now, metastasis is the surest sign of malignancy. What does that mean? That means that if we have metastasis, or if we have a tumor which is located at a distant site, discontinuous from the primary tumor, that tells us that the tumor is malignant. Uncommonly, it is the first sign of malignancy, or otherwise called as occult primary. Now, what does occult primary mean? Here it means that the primary tumor may not be evident and the patient presents with secondary symptoms. For example, a patient may have a carcinoma lung, but the presentation may be in the form of a lymphadenopathy. Here, the patient may have a supraclavicular lymph node enlarged, which can be diagnosed as lung carcinoma, but the lung carcinoma as such is not evident. Then malignancies not necessarily all the time metastasize. There are certain malignancies that may not metastasize, and you may get a Viva question or a MCQ on this. And there are two cutaneous or skin cancers like basal cell carcinoma, verrucous carcinoma. Verrucous carcinoma is a type of squamous cell carcinoma which do not metastasize. Okay. In addition to that, this is also seen in CNS tumors like gliomas and ependymomas, which do not metastasize. Before we go to details of metastasis, there are two types of spread of tumor. Okay. First is direct infiltration or local invasion. Now, this happens with tissue destruction. Let's understand it with an example. Say a patient having a lung tumor and this tumor spreads to the pleura. Second case, a patient having a carcinoma cervix which spreads to the vaginal wall. Third, there can be osteosarcoma of bone which extends into the soft tissue. So these are modes of direct infiltration or local invasion, but they are not metastasis. Now, our topic of interest, that is metastasis. Here we will see carcinoma oral cavity, which is a very common carcinoma in India, and that presents with a cervical lymph node. Okay, so that is known as metastasis. Carcinoma breast, metastasis to bone, which is common. Carcinoma colon, which can metastasize very frequently to the liver, that is an example of metastasis. Now, metastasis term is used in relation to carcinomas and sarcomas, and metastasis term is not used in case of hematolymphoid malignancies. Now, what are the roots of metastasis? So, the first root is a lymphatic root. Okay, the most common is lymphatic root, and it drains into the nearby sentinel nodes. This is very commonly observed in carcinomas, and for example, you can have a carcinoma breast draining to axillary node, a carcinoma thyroid or papillary carcinoma thyroid presenting with a cervical lymph node. The second route is hematogenous route, by which we mostly encounter distant metastasis, and it is common in carcinomas as well as sarcomas. Okay, for example, if you have a carcinoma colon which goes into the liver, or a osteosarcoma which metastasizes into the lungs. The third modality is transcelomic or seeding of body cavities. This is mostly encountered in case of abdominopelvic tumors. For example, a spread of ovarian tumor to the liver surface, or reverse, you can say a spread of gastric tumor to the ovarian surface. So these are examples of transcelomic or seeding of body cavities. There is a fourth and a very rare modality that is spread through airways, which can be very, very rarely encountered in lung carcinomas. Now, what are the steps of metastasis? Okay, this is very important. First, what happens is loss of cell cohesion. So the cells become dispersed, or they lose their bondage with each other, they lose their contact. Second is degradation of extracellular matrix. So the matrix material surrounding the tumor, they are degraded. Third is interaction of tumor cells with extracellular matrix. Now the first and second things, they interact. And the final is migration and homing of tumor cells into the distant viscera. For example, a carcinoma colon spreading into the liver. So the homing of tumor cells or the carcinoma colon cells in the liver is called as homing of tumor cells at the metastatic site. Now, what are the common sites of metastasis? Okay, so metastasis can occur from any malignant tumor to any site, but the most common site is lymphatics, or you can say lymph nodes are most common site of metastasis. It is followed by liver and lungs, which are also two common sites or two common visceras where metastasis happens. And you can also encounter metastasis in case of bone, like renal cell carcinoma, prostatic carcinoma, breast carcinoma, which frequently go to bone. And also you can rarely encounter metastasis to the brain. Thank you, sir.